my jaw, my head. Oh, I can't even open my mouth. When will this pain ever end? Lydia is suffering from temporal mandibular disorders, also known as TMDs. It's when your temporal mandibular joint, also known as your jaw, is cramping from tension. This can be caused by arthritis, stress, trauma, just to name a few, and its symptoms are debilitating at times, such as migraines, lack of sleep. It affects your clicking of your jaw and you can't open your mouth. A study was done by Sinai Rivinder and his colleagues called The Relationship Between Psychological Factors and TMDs, a systemic review and meta-analysis. This study was published by Head and Face Medicine and reviewed 21 peer-reviewed articles and found that there was a significant link between TMDs and stress and anxiety. This subject is very near and dear to me, as I have also suffered with TMDs. But I also do work with a plastic surgeon. He and I work together to help people who suffer from TMDs experience some relief. He does Botox, which helps relieve the muscle tension, and I go in and do what's known as buccal massage or TMJ massage, which helps to relieve the muscle tension also. And I also will help train people to with meditation and techniques they can use to calm their nervous system. In this speech, I will inform you about 3 treatments used to treat TMDs, with the goal to relax symptoms and even resolve the disorder altogether. Treatments such as Botox, TMJ massage, and meditation and mindfulness significantly improve TMDs by relieving stress and tension in the jaw on a physical, mental, and chemical level. Botox is a botulinum toxin and helps to improve TMDs and TMJ by chemically reducing the overactivity of the jaw muscles, also known as the masseter and temporalis muscles, involved in jaw movement. Niv Moore wrote, "Temporomandibular myofascial pain treated with botulinum toxin injection." This article from Toxins was a peer-reviewed study that was done by to review Botox and its effectiveness for TMDs and symptoms it causes. The study found that there was a significant reduction in TMD and symptoms, and it gave much relief. So what is Botox? Botox is a botulinum toxin that temporarily relaxes the masseter and temporalis muscles when it's injected into it. The nerve is blocked and reduces the ability to contract as much. What does it do? The results are decreased pain, more mobility, less grinding, less migraines, and just improvement altogether. The treatment protocol for Botox is usually every 3 to 4 months. You would get an injection. And the hope is that that injection will last longer and longer after the therapy and creating better habits. More Botox injections are usually needed and are part of a treatment plan, which include massage and stress management. So next, let's talk about TMJ and buccal massage and how they can complement Botox. Botox turns off the hyperactivity, and now buccal massage goes in and physically manipulates the tissue, taking knots and relieving stress in the soft tissue. How does it help? It physically releases the tension, decreasing pain and relaxing the muscles. It also brings oxygenated blood to the surface, which increases circulation, improves muscle tension, and promotes correction overall. Lymphatic drainage is another benefit, as it decreases inflammation and lessens the toxins, which can help to improve the health. It's usually done one time per week, and then decreases to every other week and every 3 weeks, and so on, as improvement is noticed. Buccal massage and Botox treatment treat symptoms, but next we will discuss a treatment that can directly target the root cause of TMD and hopefully correct it altogether. Lastly, by adding meditation to a TMD treatment plan that already includes Botox and buccal massage, it addresses chronic stress and nervous system dysregulation. An article written by David Cresswell and his 2 colleagues, Mindfulness Meditation, a research-proven way to reduce stress. American Psychological Association published this in 2019 and explains the details about how the brain works in relation to stress and how it can cause physical ailments to worsen them. Then it goes on to say how the practice of mindfulness meditation has been proven to reduce stress and anxiety by allowing your mind to switch from negative to positive and increase awareness in the present moment. Meditation doesn't just help you feel more relaxed, it retrains your nervous system to stop overactivating the jaw muscles in the first place. So instead of chasing relief, you're building mental resilience too. There's a couple types of meditation that can help. Body scan helps to detect the stress and anxiety in the body as you work through each part of the body. Mindfulness meditation builds awareness of the clenching and the habits that are in your body. Breath work reduces the activation of the jaw and neck muscles associated with shallow breathing. These all improve dysregulation of the nervous system, shifting from fight or flight to rest and digest, decreasing clenching, grinding, and muscle tension. It brings the things from the subconscious to the forefront so you can realize them and correct them before you continue to make it worse. It increases the effectiveness of massage and Botox as well. You are able to sleep longer and have less reactive, more calm, and it's a snowball effect that continues on, getting better and better. I believe that mindfulness, meditation, and massage should become a part of everyone's daily habits, as it can be a preventative treatment for many illnesses, including TMDs that are caused by stress, resulting in a better quality of life altogether. So, at last, Lydia has finally come to a point where TMD is an afterthought, and it's rarely a concern. All of her hard work has finally paid off. As we saw, these 3 treatments, Botox, TMJ massage, and mindfulness meditation, worked in unison to bring her a better quality of life and having her TMD become a manageable status. Meditation rewired her stress response and tension recognition, creating a lifelong habit. If it does recur, she knows she can just massage it away. And if it starts to get worse and severe maybe, she can use Botox to help forcibly release that tension and stop her from clenching altogether for some time. Now Lydia sleeps peacefully at night, and she is mentally and physically feeling so much better, having a sounder sleep.